The startling statistics indicating that most adult Barbadians are overweight were shared by Chief Medical Officer, the Most Honorable Dr. Kenneth George.
In Barbados, 74.2% of our women and 57.5% of our men are overweight, based on the Health of the Nation study. Alarmingly, the highest percentage of morbid obesity was seen in adults in the 25 to 44 age group. Obesity is not just a cosmetic concern. It is a medical and public health challenge of the 21st century that increases the risk of ill health and death.
He was speaking at the Lloyd Erskine Sandiford Center at an obesity symposium put on by the Ross University and CIBC. Dr. George also spoke about some of the policy responses aimed at reducing the level of obesity in Barbados. He pointed to the implementation of taxes on sweetened products and the banning of foods with trans fatty acids by the end of December 2025. There are also some new measures on the horizon.
Adoption of a breastfeeding policy for Barbados that promotes exclusive breastfeeding for the first 6 months of life, and saying no to inappropriate use of breast milk substitutes. And finally, introduction of bariatric surgery as a method to manage selected morbid obesity clients at the Queen Elizabeth Hospital.
Meanwhile, keynote speaker at the symposium, Dr. Amy Pollock, highlighted improvements in bariatric surgery.
Bariatric surgery is now referred to as metabolic surgery. It's no longer bariatric surgery. And why? Because we believe that the impact of diverting bowel or closing off the areas of the stomach or small intestine to avoid exposure of the receptors that lead to your hunger and determine some of your metabolic environment internally, your biome, is much more than just restrictive surgery.
The two-day symposium ends tomorrow. Ackeem Clinkett, CBC News.